1 in 3 older adults in the US is economically insecure and struggles to afford rising costs. In a recent survey, nearly a quarter of seniors reported cutting back on basic needs like food, prescriptions, and utilities in order to afford healthcare costs. Our loved ones should never have to make these terrible trade offs. What if there was a place in our communities where our loved ones could go to get access to affordable healthcare and where someone could connect them to nutritious food services or help bring monthly costs down by supporting their application for public benefits, all under one roof and regardless of their ability to pay? Somewhere that could help make these terrible trade offs less necessary. There is. These places are called federally qualified health centers, and my research looks at the role that these organizations play in caring for a growing population of low-income seniors. Federally qualified health centers are community-based organizations that offer comprehensive and affordable primary care to over 31 million patients nationwide. At these organizations, patients have access to many different services, irrespective of finances or health insurance coverage. And prior work has shown us that the quality of care that these organizations deliver is equal to or better than that of many private organizations, all at a lower cost to our healthcare system. Today, adults over the age of 65 are the fastest growing age group among health center patients. And I believe that the health center model can be especially beneficial for seniors who are balancing medical and social needs. But we historically have not thought of community health centers as important providers for our seniors. And as a result, the data that we have on older adults in this care setting is limited. I'm working on fixing this. My research uses data from Medicare and Medicaid, our country's largest public health insurance programs, to study the impact of primary care continuity on health center patients as they age into older adulthood. We know from a lot of research that primary care continuity, or having a consistent relationship with your primary care provider, is associated with many positive outcomes like better health, reduced healthcare costs, and higher patient satisfaction. I hypothesize that health center patients that continue to receive their care at community health centers as they age into older adulthood do better than other patients who do not receive their care across their life course at these organizations because of this element of primary care continuity. But some preliminary health center data tells us that many patients, maybe as much as a quarter of them, leave health centers when they turn 65. At 65, many of us enroll in Medicare, which can vastly expand the options of providers that you have access to, especially if you are low income. And while this expansion is great, leaving an established primary care provider and disrupting those important primary care relationships can be detrimental to your health outcomes. However, while I mentioned that many patients leave these organizations when they turn 65, many are also staying. And my research will allow us to understand for the first time ever, and using national data, who exactly is staying at health centers and what impact does staying have as you transition into older adulthood. This information is so important because if we can crystallize the impact of primary care continuity among the health center patient population, then we can make the case for greater investments in this program. And these investments are so needed. Right now, health centers are experiencing significant resource challenges that threaten their ability to care for the growing number of patients that they're seeing every day. health centers operate on thin revenue margins because of limited federal investments and of reliance on Medicaid reimbursements, which is the main insurance coverage for most health center patients to date. As a result, workforce retention and turnover are big challenges at these organizations, with over 70% of community health centers reporting shortages in key primary care providers. If we do not address these critical resource challenges at these organizations, more patients may be forced to leave these organizations as they age, even if staying would be better for their health outcomes. Ultimately, more research like mine and more investment in the health center program means better health outcomes for all and fewer terrible trade offs for our loved ones. Thank you.